In this video, we'll discuss the technique of doing an arthroscopic osteochondral autograft transfer system. The patient that we have is a 21-year-old male who has been diagnosed with osteochondritis dissecans of the femoral condyle. You can see the lesion on the MRI in the sagittal and the coronal sections. We begin by doing a diagnostic arthroscopy. We are shaving and removing the excess synovium and fat pad. Then we identify the osteochondral lesion. You can see the articular cartilage on the osteochondral lesion is fibrillary and the bone around it appears to be slightly depressed. This is like a grade 2 to 3 articular cartilage osteochondritis dissecans. We introduce a sizer to see the size of the osteochondral lesion, and it is measured to be around 6 millimeters in size. Now we introduce a needle and identify our donor site of the cartilage, which we are taking from a non-weight bearing area, which is we are taking it from the lateralmost edge of the lateral femoral condyle. We graft harvester, which is 6 millimeters in diameter, and then we, keeping it perpendicular to the articular cartilage, we tap it into a depth of around 15 millimeters. After introducing about 15 millimeters and checking on the depth gauge, we twist and remove the graft harvester, and we can see a good bone plug along with articular cartilage has been harvested. Now we have to prepare the recipient site for the cartilage piece. I have again taken a 6 millimeter harvester. We center it over the osteochondritis lesion and keep it perpendicular. Then we tap it in gently up to a depth of around 13 millimeters. So the defect created is around 13 millimeters, whereas the graft which has been harvested is around 15 millimeters. This difference is so that when the graft is pushed in, it really impacts and fixes into the defect. This is the defect after harvesting. We insert a depth measuring device to confirm the depth. Yes, it is 13 millimeters. And then we introduce the clear tube through which we can see the graft going in, and we seat it exactly on the mouth of the graft. As we screw the proximal end of the instrument, it starts pushing the graft in. Leave it around 4 to 5 millimeters proud, and then we introduce a plastic tap and gently tap it into position, and just tap all the edges and smoothen it off. This is the final articular cartilage, beautifully covered and at the same level as the rest of the joint.